Hey guys, welcome back to the channel. This is Pawan. I'm a registered nurse based in Sydney, Australia. And in this video, I'm going to go over all the things that I wish I knew before starting my nursing career. So let's get right into it. New graduate program is like a crash course in life. I learned so much in the first year of my nursing career, more than I ever did in the entire life before then. I know we all go for clinical placements to prepare us for this very moment, but it's nothing compared to the real deal. Because all of a sudden, you are it. You have to give all the medications, you have to deal with the family members, you have to look after the care plans, you have to assess your patients, do the discharges, talk to the doctors, and hand over to the next shift. And the list goes on. You do have a first few days on the ward as supernumerary, where you will be buddied up with another RN on the ward or whichever department you would be working in, just to get hang of things. But after that, all the responsibility falls on you. It doesn't take long to get hold of it, but it can feel like one of the most stressful times in your life. At least it did for me. I'm not saying this to scare you off, but I'm bringing this up now so you are mentally prepared for it. Because the first year of nursing career can either break you or make you. And just remember that it's hard for everyone. You've just got to get through it. It gets better. Every shift gets a little easier. And you develop your own time management skills, and you start getting familiar with your own department, and you start working a little bit quicker and finish sooner. Stick with it. It gets better, I promise. You are going to make mistakes. Scary, isn't it? But there's not a nurse out there who hasn't made a mistake in some way. You'll probably make a lot of mistakes in the first year of your nursing career. You've just got to make sure they're not big ones. The only piece of advice I can give you around this topic is stay focused on the task in front of you. Be in the moment. Calculate and recalculate your drug and your fluid orders. And if you're not sure, just ask. Especially as a new grad, I used to ask a lot of questions. I played the newbie card for a long time when I was a new grad. But trust me, mistakes are bound to happen, especially in the first year of your nursing career. But what's important is how you react to it. Be accountable. Own up to your mistakes. Tell your in-charge nurse, learn from them, and work hard to never do it again. You will meet nurses who are less supportive. It's hard to imagine, but it's true. Not all nurses you will come across are friendly and approachable. I've come across a few of these nurses during my nursing career, and I'm sure you've seen a few while you were on your clinical placements as well. Well, my advice would be not to take notice of these people. Their behavior is a reflection of themselves, not you. But just be aware they are there and they will get on to you, and before you know it, you're crying in the break room thinking you're a bad nurse because you didn't update the whiteboard. Please don't mind these people who call on your mistakes unprofessionally. Be the professional one and rise above them. And just remember, most of the nurses out there are great. They are there to help you, to clear your doubts, and to educate you. Shift work messes with you. Now, this is something that nurses struggle with in general, especially new grads. Sure, you get a taste of it while you're doing your nursing degree when you go for your different placements, doing different shifts across different healthcare facilities, but it's nothing compared to the real deal when you're actually working as a nurse. Because you're already mentally drained with the transition, and now your body doesn't even know what time of the day it is. And it's not just that. Initially, you don't get any say in your roster as well. You just have to work the shifts you are given, no questions asked. Forget weekends off, forget holidays off, and be prepared to work the shifts no one wants. This is like an initial process that we all have to go through. I remember for my new grad year, I was given all morning shifts for first few months. And back then, I wasn't really a morning person. So it was kind of a struggle getting ready every morning and getting to work at 6:30. So just bear in mind that you won't have a lot of choices when it comes to your roster, especially in the beginning of your nursing career. And just like anything else, this one gets easier too. Once you get established in an area, you will get to choose your shifts to some extent. You might be able to get some weekends off and spend time with your family and friends. And secondly, you will start getting used to the shift work too, and you will find your own routines for different shifts. So guys, those were the few things that I wish I knew before starting nursing career. But if you've got more pointers for future nursing students, please drop them in the comment section below. I hope you found this video useful. If you did, please give it a thumbs up, and I'll see you in the next video. Bye.